Good day, dear friends. Radha welcomes you to Dr. Savkina's channel. Many of you are interested in the question, can you do Nordic walking if you have varicose veins? We will talk about this with you today. Walking with poles has a beneficial effect on the condition of the musculoskeletal system and the cardiovascular system. Oxygen saturation of tissues improves, mood is optimized, weight is regulated, blood circulation is stimulated, and the walls of blood vessels are strengthened. For normal blood flow, the veins of the legs contain valves that rhythmically open and close, thereby pushing blood to the heart, not allowing it to flow back. However, under certain circumstances, the operation of venous valves is disrupted, resulting in a reverse flow of blood, which stagnates in the legs. Over time, the walls of the vessels expand and stretch. The problem with varicose veins is observed only in people. Animals are devoid of this misfortune. As practice shows, problems with veins most often occur in people with a sedentary lifestyle. Swelling appears on the legs, a feeling of heaviness in the legs becomes a constant companion of life, and the protruding blue spider veins on the legs do not please the eye at all. Not to mention the conglomerates of expanded venous plexuses. Many of us try to treat the disease with various gels, ointments, creams, and tablet preparations. However, to solve the problem, relying only on these methods, unfortunately, does not work. Physical activity plays a major role in relieving symptoms of varicose veins. However, the choice of physical loads in varicose is limited. Football, basketball, bodybuilding are not the best options. Skiing and snowboarding also pose a certain risk. However, Nordic walking is quite suitable for people with mild to moderate varicose veins. What are the benefits of Nordic walking for varicose vein disease? Due to regular contraction of the calf muscles, the walls of the veins become more elastic. During workouts, blood actively flows to the heart, reducing swelling and discomfort in the legs. Many proponents of this method of physical activity notice an improvement in well-being as early as the second week. When practicing Nordic walking, certain rules should be adhered to. Above all, you should not get carried away with very fast and intense walking. It contributes to muscle strain and can lead to blood stagnation in the legs with the appearance of heaviness and pain in them. In case the walking time with poles exceeds 30 minutes, you need to slow down the pace and take a short break. Long stops should be avoided in order to maintain normal blood circulation and prevent the appearance of edema. In addition, during Nordic walking exercises, the following recommendations should be adhered to. Firstly, with varicose veins, it is desirable to choose a road on flat terrain. Secondly, special attention should be paid to the length of the poles. First and foremost, this pertains to the optimal length, which helps to unload the legs during walking. You should start the exercise with short walks at a low pace, gradually increasing the load. During training, it's important to monitor your pulse. If it exceeds 110 beats per minute, you need to reduce the training time and lower the pace. If during Nordic walking you feel discomfort in your muscles and joints, you should stop the exercise or switch to a lower pace. From my point of view, it's very important to use compression knitwear during training, which in the long run plays a positive role preventing the development of chronic venous insufficiency. And if we're talking about complicated forms of varicose disease, particularly thrombosis and thrombophlebitis, then Nordic walking is simply contraindicated. What other exercises are essentially not allowed with varicose disease? First of all, these are jumps, squats, and step aerobics. In conclusion, I would like to note that Nordic walking is a very beneficial type of physical activity for heart and vascular diseases. However, in each specific case, it is necessary to observe the intensity of the workouts and also to engage in this type of physical activity regularly. Only in this way can we expect an improvement in the quality of life and a good mood. Stay healthy, dear friends, until new meetings.